In recent days, demonstrators have taken to the streets across China to voice frustration with their government's strict zero-COVID policy. These protests have become one of the greatest public shows of defiance against the Chinese Communist Party in decades. So what exactly is zero-COVID, and why is Chinese leadership insisting on it? Zero-COVID, or dynamic zero-COVID, centers around eradicating the virus completely rather than living with it. The communist regime uses strict lockdowns, isolation, and mass testing in areas where cases have been reported. The approach is so strict that entire cities housing millions of people have been locked down over just a few COVID cases, with reports of shoppers and workers fleeing stores and factories to avoid being locked inside. There have also been instances where citizens struggled to get food, medical care, and other essentials, as well as being prevented from leaving buildings during earthquakes and other disasters. One particular incident which sparked this recent surge of unrest was an apartment fire in Urumqi, the capital of the Xinjiang region in China's northwest. 10 people died in the fire, and many believe lockdowns prevented people from escaping and help from arriving. But authorities deny lockdowns were a factor in the deaths. These protests are not the first against the Chinese government's COVID strategy, but they do represent a particular challenge for President Xi Jinping. Demonstrators have openly criticized him for the policy, and some have even called for him to step down. But the president has continued to defend the approach, stating China has not suffered the same death rates as other countries. The country's official figures have been questioned for their accuracy, but there have been 5,200 reported COVID deaths in China since the pandemic started. With a population of over 1.4 billion people, this would make it one of the lowest COVID death rates per capita in the world. At this stage, it is unclear how China moves forward from zero COVID without major difficulties. The country has poor vaccination rates, and the shots available to Chinese citizens are not as effective as the mRNA vaccines available in other countries. On top of this, in the 3 years that China has pursued zero COVID, it has not vaccinated its most vulnerable people, nor has it improved the healthcare system to cope with outbreaks. UK health analytics firm Airfinity predicts as many as 2.1 million people could die if the policy is lifted, and believes improving vaccination rates among its elderly will be key before reopening. But given recent uproar, there are signs that the CCP is reconsidering its strategy. On November 30th, Vice Premier Sun Chenlan, who heads the country's pandemic response, told the National Health Commission they were facing a new situation as they tackle a virus with weakening pathogenicity. According to Reuters, officials in Guangzhou have begun to lift lockdowns in parts of the city, just a day after protests that involve clashes with riot police. Another shift in strategy involves allowing people with asymptomatic infections and people who have been in close contact with infected individuals to quarantine at home rather than at a government center. Officials made no mention of the ongoing protests against zero COVID. However, it appears likely they served as a catalyst for the changes.